Sadie is a 69-year-old female heart failure patient who also suffers from diabetes and high blood pressure. Her heart failure symptoms, though undiagnosed at the time, began in 2001. As time went on, Sadie's undiagnosed condition created more and more limitations for her.
My heart was getting weaker. I couldn't walk. I almost became homebound because I couldn't walk a block without stopping. And it got so embarrassing that I would stop and pretend that I was waiting on someone, you know, and it just got awful. It just got worse and worse and worse.
Multiple tests at multiple clinics revealed no blockages in her arteries, but her symptoms continued to worsen, causing her great concern.
Very frightening. Very frightening because, you know, you don't know if you're going to breathe your last breath, and you still don't know what's, you know, what to do or what's wrong with you, you know. And if the doctor don't know, I don't know, you know. So, and I had many angiograms. I went to quite a few hospitals. That's how I had these angiograms. Different hospital, every hospital I went to, they gave me an angiogram and came out normal, no blockage. But why am I having the symptoms? You know, that's enough to run you crazy.
Sadie was forced into early retirement from her job because of her symptoms. A change in health plans enabled her to seek help from Dr. Joya Torito, an electrophysiologist at New York Methodist Hospital in Brooklyn, New York.
Yeah, actually she was a very frustrated person. Because I saw her first in 2003, and she had been going from doctor to doctor to doctor, and she had got a lot of tests, but nobody really explained to her what was going on and you know, what needed to be done. They were just doing the tests and telling her, well, we did the catheterization, your arteries are normal, you didn't have a heart attack, you know, go home.
Dr. Torito prescribed a series of tests for Sadie that helped Dr. Torito diagnose Sadie's condition as heart failure.
And of course we did the echocardiogram, and we found out that her heart muscle was weak, which we knew. And we knew that it wasn't related to disease in the arteries. And when we did the cardiogram, we found out that she had what we call dyssynchrony of the heart, which is a feature by which the heart doesn't contract all at the same time. One part contracts at one time, the other part contracts at another time, and the blood just keeps being shuffled from one part of the heart to the other, but doesn't get out of the heart. So that is a condition that can be treated with medication, but also with a device that can put the heart back in synchrony. And that's what we did.
Dr. Torito put Sadie on a heart failure medicine regimen and 6 months later also implanted Sadie with a cardiac resynchronization therapy, or CRT device. Following the procedure, Sadie felt subtle but notably immediate relief from her symptoms.
My breath, I could breathe better. I could breathe better. I didn't do, after she put it in, you know, you can't do too much after you put it in, but I found myself, I could walk, and the shortness of breath was getting lighter and lighter, you know. And after a while, everything seems to be working pretty good. But she told me, you know, don't do too much right away. So I had to take it easy. And then everything I tried seems to work.
It's been 4 years since Sadie's device implant. Her heart failure symptoms gradually improved and have since subsided. She is once again able to function the way she would like to. Sadie's heart failure journey has made her realize that you can't ignore even minor symptoms like fatigue that you think might just come with age.
I would say if I knew then what I know now, I wouldn't have to go through, you know, I wouldn't have to take that long journey, you know. It's best to go least symptoms, you have to check it out because you don't know how serious it is. You don't know. The least little thing could be a big thing. But heart is nothing to play with. Living with heart failure is, to me, is a breeze. I don't want to have it, but I got it, so I have to take care of it.